Well, listen, I welcome everybody today. This is, I'm really pleased that, as I walk in the room, I see so many faces here from so many different places, federal, state, and local folks, the private sector collaborating on an important set of issues. It's funny, we use, Mark Mahoney will tell you this, he's our emergency management director in the city. We use this room for lots of tabletop exercise and disaster planning. It's usually hurricanes or blizzards, of which we had one of each last year. But there are many other contingencies that we have to deal with as a city, and obviously one of them is the prevention of foodborne illness, especially on a large scale. And so I just want to say I really appreciate the participation of not only our health department and the school health department and Fairhaven's health department, but our state partners, our federal partners, South Coast Health Systems, and everybody else who's been involved. It's scary to think what could happen, and we've had, there are instances around the country, enough instances of foodborne illness in various parts of the United States that remind us that these risks are all very real and that we have to take them seriously. And we're reminded of just how complacent we can get about disasters and big problems every time we have one of our hurricane meetings. We've had a couple of hurricanes. I use this analogy because I think it's an apt one. We've had hurricanes. Come on in. We've had hurricanes. Don't worry, I think that's Ma's Donuts over there. Don't worry about foodborne illness with that, I can assure you. And they taste great as well. We're reminded, we've had these hurricanes over the last couple of years, Irene and Sandy, and then the big blizzard, and so we're sensitized to those risks. And so we've been planning well. We have that. We have our response down pretty well, I think. Everybody knows their roles, but we haven't dealt with foodborne illness in a while, and so it's no time like the present to do that. So, as with every tabletop exercise, you get out of it as much as you put into it, and so I want to thank you for being here today, for giving it a strong effort, and who knows? Hopefully, you'll never have to use what you learned today, but if you do, if the problem arises, then we'll have to we'll be in a position to deal with it, and ultimately possibly save people's lives. So, and that's where we want to be as a city. It's city government, municipal government, town government is first and foremost about public safety, and that's the business we're in. So thank you for all you do. I want to thank Brenda Weiss in particular. Brenda excels at a lot of things. But getting a lot of people in the room, getting them on the same page is her forte. And so Brenda, thanks for making it happen. And thanks for everybody for participating. I hope you get a lot out of it. It has my full support, if you can't tell, because it's such an important matter. So thanks everybody. I hope you get a lot out of it today. And if there's any ways that I can help, if there are things that you think are really important for me to be sensitive about, then just let me know. Thanks a lot.
Welcome, everyone. Thank you for coming this lovely morning. My name is Reagan Cecchio. I'm going to be the facilitator for the day. Let's talk a little bit about the purpose of why we're here today. So now you can jump ahead to the first page of your situation manual, because we're going to be in the pages 3 through 5. There are PowerPoint slides. And then following the PowerPoint slides, there is the actual manual, and those have pages. The agenda refers to the manual pages, not the PowerPoint slides pages. So it's critical that we ensure the food products are safe for consumption. I think we can all agree with that. And that everyone involved in the food chain, from the farmer through the consumer, has the responsibility to keep the food supply safe. And we all know that at any point during the production or distribution, food can be contaminated either accidentally, which is a food safety issue, or on purpose from sabotage, fraud, or terrorist activities, which is a food defense issue. So DHHS, FDA, and CDC, and the USDA, how did the FSIS go? FISIS? Do we say FISIS? FSIS. I always want to acronym city, work closely to safeguard the American food supply. So they're continuously seeking new ideas and strategies to reduce the incidence of health incidents and support food defense-related innovation. So it's critical that local, state, federal governments and partners understand the roles, responsibilities of all participating entities. You also see that you are at tables based on sort of your specialties of the day, so you're with people who are in similar specialties. So the goal specifically of this exercise is to provide all the participants with an overview of what happens at the local, state, and federal levels during an incident. We want to focus on the role that personnel play in containing the problem and protecting consumers. And we also want to facilitate discussion among different entities, such as doctors, state and local entities, and the private sector. So, it's about understanding your roles and then understanding everybody else's roles. We also want to assess the plans, policies, and procedures and think about how you would realistically, that's a key word, apply them in an event of an incident. And we also want to develop food safety playbooks to delineate the roles and responsibilities of all the stakeholders and how we all work together to respond to a food-related incident. All right, so we have two modules, one in the morning and one that's going to be after lunch. The first module is the identification of the outbreak, and the second one is the identification of the food. You can refer to the agenda, you'll see that where those two modules are. Structure, here are the rules for the day. So the exercises reflects the policies and procedures currently in use as of May 2011. If there's an update to procedure in your jurisdiction since that May 2011 date, just make sure your group is aware of the change and work with me to ensure that we all understand what the update is. And this is the one I always say, the scenario is hypothetical, please don't fight it. There's no gotcha, there's no trick questions, it's very much, we're just posing a scenario, follow the rules of the scenario, and proceed as if you would. It may not be entirely realistic, but just sort of accept it as such. I also want to say that there's varying viewpoints and disagreements are to be expected, and that's really good. But it's critical to be that we're in a no-fault environment, no personal attacks, just be very clear. And again, there really isn't a right answer to these. It's more about sharing your experiences and what you're aware of, and us all trying to work together to come up with some common understandings of the situations. My goal is to make it a low-stress environment. If at any point you have issues with that, that you feel that it's not that way, feel free to come up to me privately or publicly if you want to do it that way. That's important for me. And you can discuss different policies and procedures that you might have in different jurisdictions during your breakout sessions and again with the larger group. But again, I always want to say, please don't fight the scenario. So we're going to work with each other to provide expertise, and we also, the second bullet is the thing that I really want to emphasize, speaking as someone who, as from an experienced participant in a tabletop exercise. I think it's really easy to leave for the day, having had a great experience, and then not really doing a lot with what you've learned. So I'd like us all to think about how we're going to take what we learned today and apply it to our jobs and functions, and also share it with our colleagues. So if we could just be mindful of that through the day, I think that would be very helpful. Okay, so at the end of the day, these are the objectives. And I think we should keep these in mind as the scenario plays out. The first objective is that we need to understand how an epidemiological investigation unfolds and the roles the various public health agencies play. That's the first objective. Second objective, to clearly state your role and contribution to an epidemiologic investigation of a foodborne public health incident. 3, to obtain a working knowledge of the specific roles clinical, public health, regulatory, and lab communities play when engaged in this investigation. Okay, next. Apply the step-by-step process used to investigate a public health situation that starts with a few cases of clinical illness through to the ultimate identification of the food vehicle. And we're going to define the process for collecting and applying the epidemiologic data related to the identification of the contaminated food product. Finally, we will assess the limitations of the public health and regulatory sectors and take necessary actions to address these limitations. So as you can see, that's a lot of objectives for the day. So I just want to keep these in mind as we go through. But at your tables, there are participants and there are evaluators. We're going to do introductions in a minute. The evaluators for each table will identify themselves. The participants, or players as it's sometimes called, will respond to the events based on their knowledge and experience. The evaluators will record and capture the dialogue and best practices that's happening at each table. They are not going to participate in the discussions. So don't be alarmed if your evaluator doesn't say anything. Their job is just to take notes and to pay attention to what's going on. Right now we're going over the roles and responsibilities of each table. So this part is actually, you'll have to assign the roles and these roles and responsibilities for your tables. Each table should have a discussion leader. That's, you'll get together. I would suggest it's the first thing you do in the breakout session. This person will lead the group as they explore the discussion questions and the breakout activities. There's also a recorder/reporter. They do not have to be the same person, but in most cases usually are. This makes sure that you're listening to me when I tell you how many minutes are left when we do the breakout session, and record the themes at the table, and they'll do the report back when we do the larger reporting to the table. So that's always one of the critical things to keep in mind, to identify those roles first. The other thing that's in your packets, I should just keep this with me, I keep leaning over, so is the personal learning inventory. That is behind the map and your parking slip in your packets. This document is designed to, for you to capture your questions, improvement ideas, action items. This is for your use. This is not turned in at the end of the day. We have a feedback form that you'll be turning in. So again, that's why it's personal learning inventory. So you can take notes in that, keep to it, refer back to it as you need. Does anyone have any questions before we begin the exercise in Module 1? I know especially for the people who joined us a little late.
I didn't get a folder.
Okay, that's critical. Do we have more packets? One of the things that I'll mention as Brenda gets that is that there's a situation manual. I'm so rule-oriented, aren't I, about the situation manual? In the packets, there are these situation manuals, and we ask that you not jump ahead at all in terms of where we are in the day. Thank you, Brenda. I know where the troublemakers are in the room. No. Brenda, should we start with Module 1, or do you expect the mayor to? Okay. So we're going to go through, we're going to start with the scenario. I'm going to say off the top of the bat that this is the part where I read aloud a lot, and I apologize in advance. The scenario can be found on pages 6 through 11 of the situation manual. That has more details than what I'm going to present in the slides. So it's just a little bit extra. You can follow along with the slides. You can follow along in the situation manual. Don't go past page 11. And okay, go ahead, Gregory. So between January 15th and January 22nd, 3 individuals in State A and 4 individuals in State B had acute onset diarrhea, nausea, and vomiting, and sought medical attention. Stool specimens were sent to clinical laboratories which isolated E. coli 0157H7. Specimens were also sent to state public health laboratories for DNA fingerprinting, PFGE, or pulsed field gel phoresis. Did I do that right? Pattern. Awesome. On February 8th, CDC officials reviewed the PulseNet data. The data showed a spike in the number of reported infections due to E. coli 0157H7 above expected background. Several strains of it entered into the database in the past few weeks from various states had matching PFGE patterns. On February 9th, the CDC coordinated a call with the epidemiologists in the states where at least one case of the strain of E. coli had been reported. It was seen as a likely foodborne transmission spread over several states with a history of being foodborne. The CDC summarized the total number of cases reported with the matching PFGE pattern, and each state reported status on their cases, lab results, and investigation efforts to date. States with one case lacked the resources to follow up. Now there's a chart, and that's also in your situation manual, but it shows the states on the left, and it shows that their total, by February 9th, there were 9 males, 29 females had been affected, 34 were confirmed, and 20 had the 0157H7 with PFGE subtype. Okay, next. This chart shows the illness onset date associated with the matching PFGE profiles. Again, this is as of February 9th. So it shows those. The date of illness onset is in the lower, on the x-axis. Okay, next, Gregory. All right, so the CDC contacted the FDA and USDA FSIS. CDC sent a notification to all 50 state health departments, and state health departments began or continued conducting hypothesis-generating interviews. Now we're up to February 11th. On February 11th, the CDC coordinated a conference call. There were 8 more cases in 3 states had uploaded matching PFGE patterns. So that's a total of 42 cases in 13 states. 28 were confirmed as matching the outbreak PFGE pattern.
This tabletop is excellent for helping me do my job better as a public health nurse for the city of New Bedford. It's imperative that I promote wellness and protect the well-being of our 100,000 citizens plus, and knowing who our resources are on the state level as well as the local level, who we can contact, what they do, what their jobs are, and how they can assist us in our investigation is probably one of the most useful things that I've ever experienced throughout my time here at the health department.
At the end of the day, hopefully I'll have a better understanding of foodborne illness, how that affects the community, how various levels of government are involved in responding to and recovering from that particular type of disaster, and the lessons learned from that, rolling that into the city's general emergency operations plan, and that'll be another type of hazard that we include with blizzards and hurricanes and floods and hazardous materials types of disasters. So it's a new venue, a new avenue that we're exploring today, and it just serves to make our emergency operations plans for the city more comprehensive.
My name is Kathleen Elliott. I teach nursing at University of Massachusetts, Dartmouth, in the College of Nursing. I teach disaster preparedness for our undergrad and graduate students. I'm also a nurse practitioner. And part of disaster preparedness is disseminating the information to students and understanding what our community partners' roles are, what our resources are, and what we can do to help our community as well in disaster preparedness. I also work in the emergency room at St. Luke's Hospital as a nurse practitioner, and again, understanding our resources and our community partners is essential.